Welcome everyone to today's webinar, User-Centered Design with the Clinician in Mind, Key Principles for Usability and Better Clinical Outcomes. I'm Alan Conlon with Becker's Hospital Review. We'll begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it's now my pleasure to start today's webinar by introducing our presenters. Karen Mann, RN, is an off-script user experience clinician and provides clinical and product guidance to improve patient safety and usability. She works with teams that test and design acute and ambulatory solutions. Prior to joining Allscripts, Karen was a clinical information system support analyst, clinical nursing manager, and RN with Einstein Medical Center in Philadelphia. Karen holds a Bachelor of Science nursing degree from Villanova University. Dr. Teague is Director of User Experience at Allscripts, where he leads a team of researchers and designers in the creation of products and services that improve patient and provider lives. His focus is on the methods and processes useful for the reduction of clinician burden and improving patient safety and outcomes. His master's and PhD are in human factors and applied cognitive psychology from George Mason University. At this time, I'm pleased to turn the floor over to Dr. Teague to begin today's presentation.
Thanks, Alan, and thanks also to Becker's for this invitation to speak on this important topic. And I'm also very appreciative, I know Karen is as well, for everyone taking the time to join us today. So our focus is on improving the usability and clinical outcomes of health information technology. And we've organized this talk into 8 principles. And while they are fairly high-level principles, we're not implying that these are the only principles that can possibly influence usability, safety, outcomes, and burden reduction, but they are the ones that Karen and I have found to be very valuable in our efforts to improve the products that we work on. So before we dive into these principles, I think it's a good idea for us to start with, let's call this a pre-principle, if you will. And that pre-principle would be, it's important to understand what usability means. And it's because it fits into so many of the principles and you can't have one without the other. And so I want to sort of pull this definition apart a little bit. Many of you have probably seen this ISO definition of usability, but it's important as we think through how to improve usability to really understand what it means and what it is, the factors that sort of lead to something being usable or not usable. And so one of the first things that I think is important to talk about here is the fact that you're designing a product or service or solution for a specific set of users, okay? And typically, it's a good reminder, those users are not ourselves. It's usually someone else that has a different set of knowledge and skills and abilities. And it's important to understand what vocabulary they use, what the mental models are for how they see the world, maybe what training they've gone through, and then what their incentives are or motivation while they're using your product, for example. This understanding of users help us figure out what can be, what simple means to them, what complex means to them, what intuitive would mean to them as well. The next piece of this definition that's important is that you're designing for use to achieve a specific set of goals. And we're going to talk a little bit more about the idea of the importance of goals in just a couple of minutes. But you're trying to achieve something with effectiveness, efficiency, and satisfaction. Pretty straightforward if you think about it, right? I want to do things with as little waste as possible, and I want to be accurate as I can and safe as possible, and I want to feel like I did a good job and that I enjoyed what I did. That's really what people are trying to do. And then another piece of this definition is understanding how all of that's going to take place within what context. And that kind of circles back around to the importance of understanding your users very well, is to understand what is the environment like within which they're working? What is the organization like? And that really comes back to the motivations and what tasks they're trying to do and within what sort of space. So really think about these things as you're hearing the principles as we talk through today and how they're designed to really support what this means. Let's go to our first principle. So our first principle is really an overarching principle related to usability and improving outcomes and safety and reducing burden, and that's following a rigorous process. And so it doesn't matter what you call it, a user-centered design process, a human-centered design process, a person-centered design process. What we're talking about is grabbing hold of and really adhering to an approach, or better said, probably a set of methods that lay out how to understand your users, measure usability, and design in a way to lead to that effectiveness and efficiency and satisfaction that we were talking about. Here's an example of a user-centered design process. And within healthcare, meaningful use, to get safety enhanced design certification, you have to attest to following a user-centered design principle, one that's sort of well known and rigorous. And they list several. You can see that list along the bottom there, ISO and some NIST. The one I'm showing you here is really a NIST 7741, and that's the one that Karen and I use. We like it for a number of reasons. One is because of the emphasis that it places on measurement and risk assessment, and we'll discuss that in just a couple of moments. But the point is you really want to make sure you've got a process for this, because it puts in place a framework, a structure for thinking about usability and all the pieces that are important. So I often tell people, it's great to pick a process, but make sure you're sort of following the whole process. Don't just pick and choose little pieces of it, because if you leave something out, that's a gap. And it's important to follow some pieces of it, but you want to try to follow all of it, because tying together the understanding of your users to how you define success and measure that success, how you're building and designing, and then knowing that you're doing it in a very iterative sort of way is really what user-centered, person-centered design is all about. And so one of the first pieces of that is this concept of understanding your users. And so our principle number 2 that I wanted to share is about focusing on goals and not features. Now let me define, I'll explain what that means, but let's look at the background a little bit here. When we think about understanding our users, we'll go out and we'll do research, right? And you'll do interviews with users, you'll maybe talk to some key informants that really understand the users and their workflows and so forth, and you'll do observations and any number of design research kind of activities that you might do. And that's great, and we'll a lot of different ways to document. This is kind of illustrating a persona way of documenting the findings and the learnings about a person. And it can contain quotes and problems and frustrations and things that they deal with. And it's a great way to sort of define users and what they care about. And once you have something like this, you can share it with your team. You should make everyone consistent in their understanding, as well as help them to develop empathy for who their users are. And then you can leverage and use these personas to help you make decisions and design trade-offs when they inevitably appear. You can understand, well, what would this user care the most for? What would be the most important thing? And so that's an important part of understanding your users, but I want to talk about going deeper than that. And I oftentimes, when I talk to people inside of our company, I like to try to get their attention. And one way of doing that is I say, our users do not evaluate our products. They don't care about features. They don't evaluate our products based on features. And typically that makes everybody in the room put their phone down if they've got their phone, or they look up and they go, wait a second, time out. What do you mean they don't care about features? They ask for features. We put features in the contract. We have our team divided up by features. Like, what do you mean we don't care? Our clients don't care about features. What do they care about then? Well, what I tell people is, well, what they care about is they care about how well those features help them to achieve their goals. And that's really, really important, because when people evaluate, if you deliver a product, a feature, a solution, and it doesn't somehow connect to how they're evaluating their goals, then it doesn't move the needle. You may spend a lot of time working and delivering something to someone, a whole set of features, but if they don't sense that it's actually impacting their goals in any way, it doesn't really do much for them. And so you say, well, what do you mean goals? When you talk about those there's some clinical goals that many of you probably know these as well. We've seen these in our research over and over again, is that when you talk about people's goals, their goal is not to order a medication. That's a task. That's something that they need to do. Ultimately, their goal is to deliver better care, to spend more face-to-face time with patients, to have peace of mind that they've done the right thing, right? Spend less time doing unimportant things and more time doing the important stuff. And quite frankly, they want to actually get home in time to have dinner with their family while the sun is still shining, right? That's how they evaluate. So if I deliver a product to someone and say, hey, we've updated this product, you're going to love it, and it doesn't touch any of these goals that we know are important to them, it falls flat. And so I think that one of the things, the reason we've called this out as a principle is because of how important it is to really changing the experience that users are having. And so I say be goal-focused and not feature-focused, and understand how challenging it be. But to do it, you have to understand what are those goals. So as a part of understanding your users, if you're going to be goal-focused, which I obviously recommend, what are those goals? And what are those high-level goals? So again, the goal is not, my goal is to log in. My goal is to reorder a medication. No, take it higher. What is it that their high-level goals are? And then once you know what those are, make sure that any feature, any work that you do, you can tell the story of how it connects to that goal. Maybe it's foundational. Maybe you need a certain feature that doesn't connect to the goal, but it allows you to put another feature on top of it that does, right? Just be intentional about design and how it fits in to the goals that people care about. But you have to understand those goals through good understanding of your users. Our third principle, and this is, as I mentioned before, the user-centered design process that we follow has a lot of emphasis on measurement and measuring satisfaction, measuring efficiency, measuring effectiveness, measuring our attainment of those goals, right? Are we touching on those goals that we just talked about? And there's a number of ways that you can measure usability, right? So there's objective measures, things like time on task, right? You can measure pass-fail, like did they solve what they were trying to do, and the accuracy, and how far off the sort of the good path did they go, right? There's those objective kind of measures you can do that. You can even do that with goals, right? So we do some evaluations of our products to understand how much time are people logging in and working on their EHRs in the evening, right? So that kind of attaches to that idea of I want to have time with my family. I don't want to work for forever, right? That's an objective measure we can look at. Then there's also these subjective measures, right? Equally important. This idea of how satisfied were you with what you did? How respected did you feel by using the product? How intuitive did the product feel? Maybe a preference between doing something one way and doing it another. And another important subjective measure is all around usability, right? And so one of the tools that we use, which I'm sure many of you are aware of this, that this is used quite heavily in healthcare, and I'll talk about it a little bit more, an example of how it's been used, is something called the SUS survey. So it's a System Usability Scale. That's what SUS stands for. And it's 10 questions. And it allows us to get a sense for people's subjective evaluation of the usability of a product or a module or a service or something like that. For those of you who aren't familiar with it, just do a web search and you can find lots of information about it, lots of examples and about its validation and reliability and that sort of thing, and also how to calculate the score. But ultimately what it does is it gives you a score between 0 and 100. And anywhere along that line is sort of your subjective usability, and you can kind of see how it kind of lays out in terms of some of the adjectives and some of the acceptability sorts of things. I wanted to point out two numbers to you just to have these in your head a little bit if you're not that familiar with this. An example of the overall industry average for EHRs, based on a recent study done, was around 45, 46, okay? The overall average for products who've been evaluated using the SUS is around 69. So typically if you're using the SUS scale, anything above that number, 69 and above is considered above average. Anything about 68 and below is considered below average. And so maybe not that surprising that the EHR is below the, considering other products that have been evaluated using this. But I wanted to show you this because it's going to come to play in a little bit. But also I wanted to show you because it's a really powerful tool for evaluating subjective usability because it takes into account a lot of different things about the product. But there's other ways of measuring usability as well. And I just wanted to show you a couple of those. There's many. I'm sure that you could do an entire talk on just the measurement of usability. This is another one that's very straightforward to use, called NASA TLX. It's measuring workload, perceived workload again, and it's on 6 dimensions. Pretty straightforward, pretty quick, easy to fill out. They also have a mobile application that you can use to do this. It's kind of neat, and it records the data for you. Another one I wanted to call out is the Maslach burnout inventory. Now, we've talked about this concept of burnout and burden, and we probably hear a lot about that out there related to the use of health information technology. This is one of the tools that most commonly gets used for measuring people's burnout. And it, again, is also a multidimensional evaluation. There's a long version and a short version. This is the short version that's kind of shown on the screen here that looks at these different dimensions of burnout. One thing I want to call out is if you're ever measuring burnout and burden, keep in mind that it's very broad. And so if you're evaluating the burnout that a group of people have in a department, maybe using your product or something, that burnout very well may be related to your actual product, but it can also involve other organizational factors as well. And so you want to make sure that you kind of tease that out as a part of your overall effort. That's why I showed the other 2 things, the SUS as well as the NASA TLX. Those are more focused on the specific product or the specific task that you're doing. Again, doesn't make them better or worse. It just need to understand what kind of question that you're answering as you go through all of that. The other thing I'll show you here real quick is this idea of, all right, so cool, I want to measure, like how do I measure, when do I measure? So we use the term measurable usability goals internally, and we talk about them as mugs. We'll ask somebody, what are your mugs? Have you defined your mugs yet? And the idea is to define how you're going to measure usability and user experience very early in the product, before you start building it. So we typically do that with other kinds of metrics, right? So performance and security and things like that, which are great. Well, we also want to include the usability metrics as well. And we want to do those very early on, like you see here on the left-hand side. We might have we've decided that the big thing about improving this product is making it easier to use and faster, right? Those have been the big complaints from our clients, for example. And so there's objective ways to do it, right? So how many errors, how much time on the task, and then subjective ways, for example, using the SUS scale to do that. And I'm showing 2 here under each one because many times we will create a target, sort of a minimum. Let's say we'll start with a minimum, saying this is where we want to, minimally we have to achieve. And then we have a target, right? This is our goal. This is where we're really shooting for. And the key is to define those early and then make sure everybody understands that that's what we're focusing on and we're going to measure ourselves against. And then what's important is you don't want to wait until you've built the product and maybe right before it goes out the door or after you shipped it and kind of cross your fingers and say, well, I sure hope we met our goals. It's important to evaluate these goals throughout the process. And that's kind of why I emphasize measure, measure, measure. You want to make sure you're measuring this process, the usability throughout. And I'm going to show an example of how to do that toward the end. So principle number 4, I know we've talked about burden a little bit and burnout here. I think one of the principles that's important to add to this is you should understand what burden really means. Understand how your users, your organizations, how they may actually be burdened. And so I just want to talk about 3 or 4 little quick sort of foundational beliefs that we have about burden that I think is really important in terms of understanding burden as principle. And the first is that burden and burnout didn't just all of a sudden happen, right? So a few years ago, when you started seeing a lot of articles, a lot of papers, and a lot of discussions around burnout is a problem. We've got to fix it. Like doctors are burning out. Like, what's going on? And I had people ask me, they said, what happened? Like, what was the event that caused this to happen? Was it a new regulation? Was it some new feature in our product? Like, what caused burnout to really happen? And my answer always well, it was no one thing. What actually happened was, and I'm not the first one to say this, there have been many articles written this, is that the healthcare system, not just the HIT, but the broader healthcare system, has had a tendency to rely on the fact that clinicians care about their patients, And they rely on that fact. And as they've added more and more to the task list of clinicians to do, they've adapted. Human beings are great at adapting. And clinicians are really, really good at adapting. And so they've taken on all this extra additional sorts of things. And what's happened is they become, I use the term oversaturated. That's the event that took place, is people were oversaturated. There was so much that they were asked to do and so much burden associated with use of HIT. And Karen's going to talk about the different types of burden that people can experience. And so I bring this up, and it's important understanding burden, because any solution for improving the usability, improving the outcomes, improving safety of electronic health records, we cannot rely on the human part of the system to adapt. We can't look to them to change. We have to look to the systems to be more supportive of them, let the systems be more likely to change. The second thing to mention is that when we talk about burden and burnout, most of us probably recognize that the impact that it has on clinicians, right? So the definition of burden is that it's an occupational stress that leads to emotional exhaustion, depersonalization, and reduced professional efficiency. It's what the dimensions that Maslow measures. And it leads to really bad things for clinicians in terms of physically and mentally and just in terms of their health. And that's enough of a reason to address this. But it also has an impact beyond just the clinician. It has an impact on patients. So burdened and burned out clinicians make more mistakes, and they're less engaged, which causes their patients to be less engaged. There are financial impacts as well to a burned out, burdened clinician. And so we have to address it more broadly that way. And the other thing to mention about burden is that it requires a system approach to address. And if you look at this is a National Academy of Medicine diagram. The two on the right-hand side there, the personal factors and the skills and abilities, are two of the 7 that are internal to the person, to the clinician. But the majority, the 5 on the other side, are all external, outside of their control. Things that, in terms of culture, the regulatory pieces, things that are going on in their environment and their organization that they work. And then also the EHR itself, or HIT, sits in that lower left-hand corner of the learning and practice environment. Now, I don't say that for the reason of saying that we get a pass. You know, those of us developing EHRs or developing health information technology or customizing or implementing it, hey, look, we're just one little tiny piece to this. You know, don't worry, it's somebody else's fault or whatever. Like, I'm not saying that for that reason. I'm saying it because I say that we have more than just an opportunity. We have a responsibility to address burden and burnout through design. Because if you think about design and you think about an interface, that is the front door to so many of those other factors. So what you see in that interface oftentimes is regulations and organizational and administrative and billing and the financial pieces. They show up in that interface. So through design, we have the ability to make significant changes to that experience that people are having. And we're going to talk about how we can do that through design. But I wanted to mention one more thing before I turn over to Karen to talk about some of those real specific design examples. And so it's important to understand that even small improvements in the usability of a product can have an impact on the user, a real impact on the user. And I might even say this principle in a different way, is small changes in usability can have an impact, meaning positive changes as well as negative changes. There's a study that's recently come out earlier in the spring. Spring seems so long ago with all the things that have gone on in our world. Take a look at this article. Just look it up. It's available online. And what they did was a really cool study. They asked clinicians across the country, across a variety of electronic health records, to fill out the SUS scale that we talked about before, to measure the subjective usability of their product. And they also had them fill out the Maslow. They wanted to understand burnout. And what they came away with in their conclusion was that for every 1 point increase in the subjective usability. Remember, I showed you that scale, 0 to 100. So from just going from a 50 to a 51, or a 60 to a 61, it was associated with a 3% reduction in the likelihood of burnout. And I like to show this to people inside of my organization and say, look, just small improvement can have an impact. Yes, we're going for bigger improvements. We need to make big improvements across HIT. But look, small things can have a real positive impact. I also use it sort of the other way around, is to say, this is why even the little stuff matters. This is why when someone makes maybe is fighting for a color choice that we know won't be easy to read, or something in terms of a design flaw, or maybe someone says, well, look, I know we're not going to be able to really clean this up ahead of time. We've got some problems with the way this is laid out, but it's not going to stop people from doing their task. Well, okay, it's not necessarily going to stop them from doing their task, but if it's reducing their perception of the usability of this product, we're adding to the likelihood of burnout. And so I think it's important to understand that small usability improvements can have impact, but also small usability defects also have an impact, but going in the different direction. I'm going to turn over to Karen now to talk a little bit about our sixth principle. We've mentioned the impact that we can have through design. She's going to talk about how you do that now.
Thanks, Ross. So similar to healthcare and medicine, user experience has a science that we follow for design. And also similar to medicine, sometimes the science doesn't feel natural. And so I'm going to go through a lot of the science that we use in our designs and some of the things that can help you as you're implementing EHRs or creating interfaces for people to use that will help the usability and help people process information quicker and more accurately. And that follows a scientific research around that. So to get started, should we do everything possible to reduce clicks? And I have this slide in here because I get asked all the time, there's too many clicks. I have to click all the time. And it's not that the people talking about this are wrong. They do have too many clicks. So what we did was we created an EHR that had no clicks, and we actually even made it better, and we said no scrolling either. So here you go. Here's your new EHR. Now, when I do this in person, I can get reactions, but usually it's a groan, right? This EHR is not usable. Why? You can't read anything. There's too much information on the screen. So what the science tells us is there's three different types of burdens. Ross alluded to this earlier. There's motor burdens, which are things like clicks, scrolling, things that you're actually using physical motion for. That's what you tend to notice, right? That's the things that you're counting. You're noticing if you have to scroll. You notice if you have to click everywhere. Then there's sensory burdens, which are things that make it very easy to read, like font size, colors, things like that. And then there's cognitive burdens, which actually slows down your processing of information and makes it easier to make mistakes while you're reading the information. And what science has shown is that as each of these burdens has a different impact on you. So the motor burdens actually have less impact, even though you notice them more, than the cognitive burdens, which actually will impact your work even more than the motor ones. Now, that's not to say that it's okay to create something that has a ton of clicking. A lot of the clicking complaints that I get are really a symptom of workflows, and we haven't arranged the screens with the right information on it, and you have to go too many steps in to get what you need all the time. So we're always balancing all of these different burdens, but the cognitive burden is really what's making you feel uncomfortable and what's really making it hard for you to do your work. So let's say I would ask you to go for a walk, like a little mile hike through this field. That doesn't look too bad, and you'd probably say to me, sure, Karen, that sounds great. Nice break in my day. But what if I asked you to do it in work boots? Well, that's going to be a little bit harder, but you probably could still do it. Probably wouldn't be too challenging. And then I'm going to give you a backpack to carry. Okay, well, that's a little bit harder. I'm going to have to work harder to do that. And then I'm going to fill the backpack with rocks. The thing with usability is a lot of the little things that you do on their own aren't a problem. So if you had to carry one rock on a walk, it would slow you down a little bit, but not really that much. But if I fill a backpack full of rocks and put boots in your way and make it harder for you to walk, then the overall experience is going to be that much worse. And you're going to feel that a lot more than just taking a walk without any of those things in your way. Let me talk to you a little bit about processing fluency. Processing fluency is the ease with which a task or a chunk of information is processed by the brain, how quickly you can get it through and process that information. Experiencing fluency puts you in a positive mood and also gives you a sense of familiarity and effortlessness. Sorry about that. Even when an interface does not contain difficult or unfamiliar items or elements. So if you think about if you were to drive to work on a Sunday morning, it would probably be a very smooth drive. You don't have a lot of cars in the way. Maybe you get lights that are quick. You could make it very quickly because there's not a lot you have to focus on. There's not a lot in your way. That would be really good processing fluency. But if you're driving during rush hour, now you have a whole lot more cars. You have people zipping in and out of lanes. You have to focus a little bit more on the road, on the lights, on what's going on around you, and it's slowing your processing down. Our goal through all of our interfaces is to increase the processing fluency, and what that does is reduce that cognitive burden that I talked about, which allows you to process the information quickly and efficiently. So this is an example of how to take a medication, a prescription. And if I were to ask people, how easy is it to take this medication, on the first one, they would say it's fairly easy to do, maybe like a 7. If I ask them with the second one, that number is going to go down quite a bit. Now, if you read the words, the information in the italics, or the information in the words are exactly the same. How you take that information, or how you take that medication is the same in both of my examples. The only difference here is the italics, but reading italics is actually a little bit harder for you to read. And so the fact that it's harder for you to read means your brain translates that as it's harder for you to do that step or to do that instruction. So doing things like making it clear and easy allows your brain to consume it quicker. And then in this case, you have a patient that's much more likely to take their medication correctly as opposed to messing it up just by the use of italics versus not italics. Same thing with these forms. If you looked at these forms, it would take you a lot longer to fill out the first form versus the second form. Now, why is that? If you look at the forms, the information is exactly the same. However, but the problem is alignment, right? So the first one actually is more time, it's more cognitive burden, and you're much more likely to make a mistake. Now, if you look at the lines that I've added to this, you can see that the big difference here is the way that the information is aligned. When you're trying to read information that's misaligned, your brain is trying to figure out why it's misaligned and what does that mean. Now, sometimes you can use things like indentation to say this is a child of this header or this is a subset, and there's appropriate use for when you should realign things. But by doing it too much or even just not aligning it in the first place, it's going to slow you down. So anytime you're looking at forms, anytime that you're trying to fill out information, making it very simple and easily or very well aligned is going to make you move faster, and it's going to reduce your risk of mistakes. Proximity is another issue in some of our EHRs. Like here, if I were to ask you, at what age does your partner plan to stop working, your inclination would probably be to say the 67 on top. But actually, the form is down here at the bottom. So the 67 is actually closer to that question, what age does your partner plan to stop working? But the answer is down below. So if you look at something like an order form, here if I were to ask you to say, the patient's allergic to tree nuts, you would most likely click on this checkbox here next to tree nuts. But if I show you the whole form, you're going to see that by doing that, you actually made the patient allergic to eggs. This alignment is not good, and it draws your eye, the label draws your eye to the item closest to it. So it would be a very significant problem if the patient was allergic to tree nuts and you did eggs. But making sure that things are properly aligned with our entry and your labels are clear will help you process that information quickly. Another thing we look at is font size. And I think historically in most EHRs, the font sizes are very small. I get that complaint all the time. I can't read it. People are getting older as they're trying to read it. And what we follow is the 007 rule, which really means that in a perfect situation, if the distance from the computer is about 18 inches, then you would get a font of about 0.126, which is an 11-point font. So for most people using a computer in ideal situations, 11-point font is the lowest font that's readable. However, how often are you sitting at a computer in healthcare in optimal conditions? Most of the time you're moving around, you're talking to the patient, you might be further from the screen. So by creating fonts that are bigger than that, it actually will allow you to read the information quickly and then not misread something because the font is too slow or too small. In this exercise, I want you guys to take a minute and I want you to yourselves name the color of each of the objects on the screen. So just go down, you can go left to right, top to bottom, and just in your head, name the colors. And I want you to do it accurately and correctly. Now, for most people, that takes about 30 to 40 seconds to do that. I'm going to ask you to do the same thing on the next screen. This screen should feel a little bit more uncomfortable and it's harder to do. Now, why am I having you do this exercise? I get asked all the time, put more information on the screen, I'll only look at it when I need it. However, your brain cannot ignore certain things on the screen. So in this case, it takes people a lot longer to do and people make more mistakes along the way because even though the item, the object here is red, the word says blue and your brain doesn't turn off reading blue. And so when we're creating our screens, we're trying to determine what is the essential information and what information can we take off of the screen and maybe make one click away that you don't need all the time. By jamming it on the screen, it's going to make it harder for you to read, harder for you to process the information, and to really scan through and get the information that you need accurately and quickly. Next, I'm going to talk to you about date formats. So for most people in the United States, at least, this is a standard date format. That would mean December 10th, 2016. I know in other countries, you may switch the order of that, but the date format itself is pretty clear and easy to read. So if I gave you a list, two different lists of dates, and asked you to read through them, which one do you think would be easier and faster? What we found is that in this first list, it takes about 8 to 10 seconds for most people to read and accurately process those dates. In the second list, it's 14 to 18 seconds. The reason being that even though the date format is pretty standard, and assuming it's in your own date format, you still have to translate the month, which takes time. It slows down your brain, and people will say, what month is 5 again? That's May. Versus just putting in the month in words, you don't have to have that translation. So you're going to process that date quickly and accurately and make a lot less mistakes when you're doing the dates. Next, I'm going to talk to you about the use of color. In healthcare, I get a lot of times I get requested about using color. We'll be testing screens and they don't have a lot of color in them, and it's usually, well, couldn't you add this color for, say, different visit statuses or for this or for that? The problem is that color has meaning. And so the more color you add to the screen, the more it's going to slow you down to try and determine the meaning of the color. So we use color for certain tasks to make sure that you can accomplish your goals. Like going back to what Ross was talking about, in the end, you want to accomplish your goals, and that's what's most important. So we were asked to redesign this screen, and in this screen, the task was to focus on readmission scores that are too high. So can you do that? Sure. You can do that. You can see the higher ones are red. But what if we did this? For those of you that may not have noticed, we changed the green to blue. Now you could say to me, but Karen, green is good and these are trending down, so that's good, right? That's true, but your task is to find the information, the ones that are trending up. Green actually competes with red. So in this case, by putting this down to blue, it's actually quicker to highlight the red information, and you still have the blue information if you need it. And we could go even further and do this, and that would make your task even easier, right? Float all of the ones that are out of range on the top, and then as soon as I hit blue, I know I can stop worrying about those areas. So let's take this on a little bit broader scale. This is a screen that was designed by our content team, and they actually used colors that we recommended on the UX team. And they came back and said to us, you know, the screen just doesn't feel right. It's just too dark, it's too busy, it doesn't feel clear. And the challenge was we gave them colors without putting it all together, right? So we just said use this color for the header, use this color for the background. So they were right. So what we recommended was removing this gray background. Actually, the background's there, it's just a lot lighter gray, reducing that color contrast. And then we're going to tone down the most common headers from teal to a gray so that they're not competing with the subheaders. And then we also, at the same time, recommended using consistent spacing, which will allow you to scan the form and also to focus on alignment. So here's the new form. Now here, you can still read this form. You can scan it, but it's not as jarring when you first bring it up and like, whoa, what is going on here? You can focus on the information that's really important to you, like filling out the form. And when you're using colors, color contrast is important as well. So here you can see color contrast is important because it has a huge impact on fluency and adds to cognitive tax that our users have to pay. The ideal ratio for color contrast is 4.5 to 1, and that's meeting the AA requirements. If you want to go up to AAA, they actually recommend 7 to 1. Now, for most of you, this probably feels like you can read most of these fairly easy, with the exception of probably the green and yellow. But when you look at the contrast, most of them do not meet the 4.5 to 1. The blue and white does, and the green, but all the rest of them are really poor contrast, which is going to make you harder to read that information and to get what it is that you're trying to portray with the use of color. So when you're using color, make sure that you're using a contrast that's going to be easily read so that people don't have to stop and slow down. Now here's an example where we had a customer come to us, and this is not, this is a dummy database. There's no real patient information on this screen, but they wanted to put color in for all of the attending. So each attending would have their own color. So you can see over here on the right-hand side, there's all different colors there. So we did a test of that, and what we found is that really out of most of these, there's only a couple that pass the contrast ratio. And that's at the lower, there's only 1 or 2 of them, I guess, that pass the 7 1. So those 2 are the best color contrast. The rest of them, it's very hard to read. And so we recommended they don't do that. And what we also discovered when they sent us the screen is that here you're using red to highlight something that's out of range or very important. But the contrast is actually off, and so you can't read it. And so that needs to get changed as well. So the use of color should be very limited to things that you need to highlight, things that you want to focus on, and then use colors that fade back in like blues or grays to allow you to scan the other information, but without it getting into your way or decreasing the processing fluency. Another thing we use in terms of science is hierarchy. Now, hierarchy is a great way to allow you to focus on specific information. Like if you're looking at a list of patients, the patient name should be a bigger font, easy to read, so you can scan to find that patient. Or a list of medications, the most important thing is the medication name. You still need the instructions, but if you're scanning the list, you want that to stand out. And there's a lot of different ways that I'm going to talk about how you use hierarchy, but one thing to keep in mind is that it is a finite resource. So you don't want to use too much of it. And if you think about going to a diner, you have those standard placemats with all the ads and colors and things on it. That gets very confusing, and it kind of hurts to look at it because there's too much hierarchy and too much color going on. So just keep that in mind. Hierarchy is important, but make sure you're not overusing it because that will also lead to slowing down your user's processing fluency. So some of the things we use for hierarchy is size. That can be size of font. It can be size of a box. Just things that are bigger are going to draw your eye quickly. The position on the page, reading left to right, top to bottom, you're going to notice things in the top left corner first and then work your way down. So if it's really important, don't hide it in the bottom right corner because people aren't going to probably see it there. Highlighting, things like the use of bolds, italics, underlining, typeface, color, inverting the colors are all good ways to draw attention. Keeping in mind some of the limitations, like with italics. It might be okay to put things in italics if it's a little bit less important, and it's okay that it slows you down. You don't want to use that as your primary, but it is a good way of differentiating things on a page. And then also nesting, using things like PowerPoint, where you can do indenting and bulleting, probably not bulleting, but indenting to show a relationship between two items. So here I'm going to look at, looks like, again, this is fake patient information, but here you can see right now, if you saw this, you could read this. You would know the patient's 52 years old, their date of birth is May 25th, they're female, and this is their MRN number. But what if we reverse the bolding? So what we did here was bold the values instead of the labels. And by doing that, now you're focused more on the values, which are more important. In healthcare, the labels are usually secondary to the values, right? You want to see what the vital signs are, not that they were the diastolic or systolic. You mostly know what you're looking at. You just need the labels as a little guidance. So here we decrease the font size of the labels. So now it's even clearer what the values are. And then we reduce the color on the labels because unless you have like 5 dates here, you probably know its date of birth. It's related to years, right? So you don't need that. And then finally, we switch the date format to make it even easier to read. And then in some cases, it may be okay to take out the labels altogether. Now granted, if it's going to be confusing, if you had an MRN and a visit not ID, you might need labels there. So you have to do that wisely. But for something like 52 years followed by the birth date, do you need the labels there, and can you condense the information and make it even clearer to get that information that you're looking for? So all of these items taken on their own seem like very small things, but as I said at the beginning, when they add up, it's like walking around with rocks in your shoes, and it makes you very uncomfortable as you're going throughout the day and adds to that burden that you're feeling, our users are feeling as they're going through the EHR. So the science tells us, use larger fonts, use less color, narrower columns are easy to read, less information, more white space. I didn't talk a lot about white space, but that's something that too much information on the screen makes it very hard to process. So using white space makes it easier to read, using an alignment and hierarchy. And when you do that, it's going to lead to greater efficiency, you're going to be more effective, have higher satisfaction, safer care, and better decisions, which is really important in the end. So I'm going to turn it back over to Ross, and he's going to talk to you a little bit about helpfulness.
Thanks, Karen. So 2 more principles. We'll kind of move through these quickly and see if we can save time for maybe at least one question at the end. So we talked about following a rigorous process. We talked about measurement and the importance of that. And Karen talked about the fact that there are specific things related to design that we know what the result will be from in terms of people's reaction and burden and behavior. And that's very much necessary, but we've found that there's something else that's needed to really move the needle in terms of significantly changing the overall experience of HIT. And that is really the idea of following a philosophy of helpfulness. Let me give you a little quick story about what I mean by that. Is I was talking to one of our clients, and he said, Ross, you know what, when you think about an EHR, let's call it a snow shovel. You make changes, you apply good science to design, and it's better, but it's a better snow shovel. Yeah, it's lighter. Yes, I'll always take the better one over the old one. But what I really want is a snowblower. That's what I want in a product. I want you to deliver a snowblower to me. I really thought about it. I said to him, I'm not sure you want a snowblower. He's like, sure I do. I said, I think what you want is a clean driveway. He's like, well, yeah, ultimately that's what it is. And so I really started thinking about that, and we, as a team, started thinking about this concept of what does it mean to provide the most help possible, right? So there's one way is giving somebody a better snow shovel in this example, but what if I just can achieve the goal for you without having to even provide that tool? Let me give you a clinical example. So this is some question and answer I did with one of our clients. And said, what's your day like? And she spends a lot of time in the evening getting ready for the next day, and you can kind of see some of the things that she talked about. At the end of that, she said, so here's what I need, Ross. I need a code dictionary because I need to look up some things that I don't always familiar with, and It'd be good if I could see the schedule when I'm over in this one section. And that's kind of what I need. And I challenged her. I said, okay, yeah. And I said to her, I said, that's a better snow shovel, though. And she's like, what do you mean? So I kind of told her the story. And I said, tell me what is your clear driveway? What does that mean? What would it be if this product was more helpful to you? Okay, what if this product, don't think about this product as a tool you use. What if it's a tool that provides help to you? And she's like, okay. And she really got into it. And she's like, okay, I don't want that code dictionary. I said, what do you want? She said, you translate it for me. All right, what else? She said, I spend most of my evening clicking all around the EHR, trying to make myself confident that I've seen everything and that I can orient myself to the patient. I want you to orient me to the patient and assure me that I've seen everything. That is, we call that helper language. And that's really what we try to do is we're brainstorming and we're thinking about how to address people's problems, is asking the question, what would be the most helpful for this user? And then I call it innovation rocket fuel. Then defining, well, then what would it take to build that and deliver that? And then you want to do all of that with the design principles we talked about in measurement and with usability in mind. But now you're designing for this idea of being helpful more so than just the delivery of features as we had talked about.
So,
Karen, if you'd like to, yeah, go ahead.
Yeah. So this screen is an example of something that is not helpful, right? So I asked the question, is this screen helpful? This screen is actually to give alert information, a drug interaction here. And you can see on the screen, first of all, you can't see it on this screen, but it pops up over the content. So no matter where you are, this comes up on top. So now I have to stop and address it. There's actually limited actions that I can do here. So I probably have to go back and fix something if there is something wrong that I want to change. There is lots of color, but I'm not sure that they all have meaning and that all needs to be there. And then the main meat of what's wrong here is this tiny little box in the middle that I have to scroll through to find out what the reaction is. So the screen works in that it gives the user the interaction and they can get to the information, but it's not very helpful. So we were looking at other ideas of how could we make that more helpful. Well, what if when I created the drug prescription, it's right here in line. I can see it in line. So then if I need to change something, I can do that. I can acknowledge it here. If something's the wrong dose, I can address it without leaving my workflow. And even more helpful would be if I could put it in the search so I don't even select that item. I don't even select that item because I know that there's an alert, so I could hover over there and see it. So here we're looking at notify me when I'm making a decision right then and there. Don't wait till later. Warn me in a clear and easy way of potential problems so that I can address them right away. And then if there is information that is more severe, then you can use color. In this case, it's yellow because it's an interaction. But if I should not order this medication, that could be a red banner right there to say, don't order this, right there, make it clear and in my face so I don't make mistakes. This is another screen that we've been working on for Prescription Writer. And here we've spent a lot of time adding helpful features in here. So you can see here, we have an enhanced search. So I can not just, instead of just typing amoxicillin, I can type amox 25 liquid. And then my search will go down and I can quickly find what I'm looking for. We've integrated the PDMP so that you have access to that right there with some status saying, hey, there's information here you may want to go look at before you prescribe something that's a narcotic or on the list. We integrated one place to add, to search, and to submit our form. Instead of having to go to 3 different places, it's all right here in one place so that when I submit it, I'm done and I can move on. And then we're also adding insurance coverage for things like whether it's a preferred, or in this case, the medication is not preferred. So maybe I want to go find out which one is preferred so that my customer's not, or my patient's not getting charged as much. So just thinking about more than just the design of the screen and how do you integrate the workflow really leads to that helpfulness that Ross was talking about, where it becomes more of your assistant and very natural in how you're going about your day. And then finally, this is an example of a dose calculator. And we had heard in the past, well, the one we had in the past is really hard to use. So we did a lot of research and talked about what would help you. So here, I typed in I wanted 30 milligrams per kilogram per day every 12 hours. What that did was create the calculation for me, and it shows me the results. This is how much per dose that you want. And then to be even more helpful, I can't tell a mom to give 3.18 mLs. That's not really a dose that can be given by a regular patient. So we're allowing it to round up or down to just quickly say, let's make that 3 mLs, but telling you, what's that going to do? Is that going to make it so it's not effective anymore? Is that going to overdose if you round up? So giving you cues to say, okay, I'm going to order this one, and so that I can get through that and make it easy for mom to use. And then we also added calculation steps. This is collapsed, but you can expand it. So if you really want to see, is that calculation correct, then it helps you get confidence in the system and know, okay, yes, it's following the way that I would calculate it.
So our final principle is, yes.
No, I was just turning it back to you, sorry.
Oh, sorry, okay. So our final principle is formative testing rocks. And so for those of you who know user-centered design processes and usability, you know this yourself. And I think it's a part of a rigorous user-centered design process, this idea of collecting feedback from users throughout while you're using a product. And so I'll just show you this real quickly here. It's the idea, it's not a demo, okay? So it's not going out and showing a user, this is what we're building, this is how it works, what do you think? It's very task-based, putting a user in front of a product. It could be a paper prototype, it could be a interactive prototype, some working code, and asking them to complete a task with it. How would you do this? Show me the way to do this. Can you find whatever it might be? And there's a lot of really valuable reasons for doing this, one of which it allows you to make decisions with data. So maybe somebody said, we should try it this way, or maybe a very loud client said, I think you should do it this way. Well, now you can have data, objective and subjective. Is it working for people? And also, as I mentioned before, as you're creating your measurable usability goals, and then you want to get feedback throughout, if you're on track to meeting those goals, this is the way that you do that. It's a great way to measure those measurable usability goals. And then just even something like this screen here, a paper prototype, I could ask a user, and we've done this before with the screens, to do things like renew a prescription, pay a bill from an appointment that you had in the past, schedule an appointment to see your doctor, and find out, do they even know where to go? Do the icons even make sense to them? What would they expect to see, to be able to do when they click on a certain button? And so that's the idea behind this, is that even this level lets you get directional feedback very early on, and you can see how it's so important for doing this and collecting feedback as you go forward. And so just wrapping it up here, and Alan, I'll turn it back over to you in just 1 second here, and if there's time to squeeze in a question, we can. But we talked about these principles. As I mentioned, there's many other principles. But the highest level principle is following a rigorous process, and within that, you get a lot of these methods and these guidelines for things related to understanding your users and measuring and doing that formative testing. And we can do our part through design to improve usability and safety and outcomes and reduce burden. And I encourage everyone on the call to give these principles a try if you haven't already, and if you have, keep it up. Thank you for the time today. Alan, I'll turn it back over to you.
And thank you so much, Karen and Dr. Teague, for that fantastic presentation. It looks like we have time for at least one question, but please do submit any questions you have by typing them into your screen, and we'll try to address them at a later date. One audience member asks, most EHR vendors have talked about solutions that include technology to improve usability, such as artificial intelligence and voice. What are your thoughts on that for improving usability?
Okay, that's a good question. I get that question often, and one of my responses is usually I ask this question back. Well, can we think of an example when technology added to healthcare didn't lead to a good experience? And people generally nod their heads and go, yeah, of course we can. I mean, that's why we're talking about all this new technology and everything, because of the problems that we have. And so there's a lot of promise in voice and AI, but my caution to folks is that the addition of that technology doesn't ensure usability. So using something like formative testing that we talked about, very task-based to understand that. I think when we talk about these technologies like voice, like artificial intelligence and so forth, there's also the social aspect and trust to evaluate. And so my caution to folks is that just applying technology won't solve the problems that we face, but we can if we make the technology a part of the design process and not something that's separate from it.
Fantastic. Thank you so much for the clarification there, Dr. Teague. That is all the time we have for today. I do want to thank again Dr. Teague and Karen for their excellent presentation, and Allscripts, of course, for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to seeing you for future Becker's webinars.